beginning of the pandemic, when we didn't have any immunisations, when things were still evolving, no one really understood COVID, there was a lot of incredible research going on, but we still had people turning up at the hospital. They were trying new things, trying to find ways to comfort and care for them. So my role as head of music therapy, we actually did a lot of that comfort and care, and we sang to patients that, we really couldn't help cure through the windows of their care. And we would have our masks on and shields, and still through that, singing through for that human connection. And it was beautiful, but also really, really tough for healthcare workers, because often we'd be holding people's hands knowing that we couldn't help them. And we were really at that point of comfort. Global Scrub Choir started at the beginning of the pandemic. So in the earlier days of the pandemic, people were afraid to come into hospitals. And so part of our messaging was, we're still here, we're doing our best, and we really want to keep caring for you. So that was the initial messaging. So I reached out to my healthcare colleagues and said, would you like to do a choir? And I thought maybe 20 would say yes. Then 200 joined, and we started making the videos, and then from that it just kept growing and growing and growing, and more healthcare workers were involved. We reached out to our colleagues overseas, colleagues from Zambia, South Sudan, Japan, Norway, UK and Brazil as well.
This virus, it exposed and exacerbated vast inequities and wide cracks in our defenses. And it reminded us that we are one humanity. We may be tempted to think that the COVID-19 pandemic is history. But history teaches us that COVID-19 will not be the last pandemic. The question we all face is whether we will be ready when the next one arrives.
So as a healthcare worker, I'm passionate about access and equity to good quality healthcare. And good quality healthcare addresses the whole human being, the heart, the mind, mental health and well-being, physical health and well-being. And universal health coverage is reaching out and making sure that that happens to all people, that all people across the world have access to this. It is a basic human right.
I think it shouldn't matter where you come from, what your background is, what your medical history or social history might be. Having access to universal health care, having access to fair and equitable health treatment is crucial and is a fundamental right for everybody. I hope we're able to spread that message of a hope and of a better future, because I truly believe it, and I think it should be a reality for all.
Health is not only a fundamental human right, but it's also fundamental to peace and security. A healthier world is a safer, fairer, more peaceful, and more prosperous world.